What's up, you guys? It's Numi. I hope you guys are having a great, what's today? Today is Friday. So I hope you guys are having a great Friday. I wanted to come and make a video about my rotation that I basically completed, kind of completed, didn't really complete, but I've always made a video regarding like our rotations and the ending in my experience and all of that, and then just posted it. So, just because of everything that's going on, I don't want to stop that. Hi, Noah. Can you say hi?
What?
You don't want to say hi?
I do.
Okay, well, I'm making a video. Can you go out?
No, I'm gonna say with you.
No, because I don't want you to make noise. Out. Close the door. Thank you, love. So anyway. Oh, he's about to do some work. So, and yeah, a lot of my videos are off the dome, right? Well, basically all of my videos are off the dome, and whatever happens in my environment is just a part of the video. Sorry, I don't really edit them like that. But anyway, so I was in my surgery rotation. I do have some notes here because I want to try to stay on topic, because sometimes I get off topic and I'm trying not to do that for this video, so the video is not too long. My surgery rotation was supposed to be 3 months long, right? So we started in January and it was supposed to end in March, sometime the end of March. And we basically made it almost to the end. I was actually released 2 weeks earlier than I was supposed to, only because of the COVID-19 virus. Our school just did not want to put the students at risk for contracting a virus, so they basically pulled all of the students out of all of the clinical sites across the United States. So yeah, we've been out now for almost 1 month, if not a month for sure. And technically I'm supposed to be in my internal medicine rotation, but right now we're not doing that. We're basically doing online that our school has provided, like a 5-week course so we can get credit, and that's how we're approaching that. But anyway, it was supposed to be about 3 months long. It was about, I want to say maybe like 20 of us, maybe a little over 20 students that were there. And so we were divided up in groups, and the groups were about 5 or 6 students. It just really depends on who was coming in and out of your group, because sometimes we had students from like Florida Atlantic University, we had PA students, we had some 4th years that were just coming to finish up their electives. So, it just really depends, but most of the time it was between 5 to 6 students, at least from my group. We worked shifts, so there were about 4 to 5 shifts. Let me see. We had a 6 a.m. shift to 12, then we had a 12 to 6, then we had a 6 to 12, and then we had a 12 a.m. to 6 a.m. So it was 4 shifts. But they ended up, initially it started that way, and then they ended up taking that 12 a.m. shift to 6 a.m. and making that just like an outpatient clinic type of shift, which would be in the daytime. And I definitely appreciated that, because to be honest with you, the 12 a.m. to 6 shift was kind of a waste of time. Because there was really nothing going on during that time. I mean, we were supposed to be there for traumas, because the hospital that we are affiliated with down here is considered to be a trauma 1 center, but because of the population that's here, they don't really get a lot of traumas. Mostly they will get like people that have falls and things of that nature, because the average age for that hospital is around 81, 82 years of age. So we're dealing with a lot of older people that, are at risk for like strokes and falls and, things of that nature. So we really didn't get a lot of trauma. We did get some, but not a lot. And I really never saw any trauma while I was there, like at all. So that's why a lot of times, that's why I think they got rid of that shift. And basically, the shift before that, the 6 p.m. to 12 a.m. became kind of like the shift for if trauma came. But anyway, so those are the shifts, and this was a general surgery rotation. So we basically just saw everything. And one thing about general surgeons, I will say, their life is in the OR, right? So if you are interested in something like that, where you want to be in the OR all the time, then general surgery, and you want to use your hands, general surgery is definitely the way to go. And of course, there are avenues in surgery that you can choose if you just don't want to be a general surgeon. General surgeon, you can do other things, and you know, not be in the OR all the time. So I personally did not like being in the OR all the time, and you know, I didn't like just always being in someone's body all the time. So that was something that I didn't like about that. But that's basically what we did. There was a lot of procedures that we saw, a lot of exploratory procedures, and exploratory procedures are basically where a patient comes in, they're having signs and symptoms of something that's in, you know, like abdominal something, you know, mainly. And you know, the symptoms are getting worse, and the surgeon is like, you know, they kind of know what's wrong, but they need to open you up to kind of see what's wrong. And so that's kind of what they would do. They would just basically do an exploratory abdominal opening of someone, you know, and usually there was something there. I only had one patient that I followed where they were not sure what it was, but they did find something, but it was different than what the person was actually complaining of. And so the surgeon had to get an additional permission to do what he needed to do, because it wasn't emergent. If it's an emergency, they don't have to get a consent for that. They just go ahead and do it, and they let the people know after. But this was something that wasn't emergent, but they just wanted to kind of go ahead and do it. And he basically had the nurse go and find the spouse, and they talked to the spouse, and then they were able to get additional consent to take care of whatever they needed to take care of in that patient. A lot of hernia repairs, we saw those. Also, one of my cases personally that I had a patient from Canada who basically threw a clot from his heart due to atrial fibrillation, and the clot ended up in his one of his major vessels in his stomach and blocked that area, and his bowel became ischemic, meaning it was dying. And this person, for this particular issue, the mortality rate was like an 80% mortality rate. And here I am there with a doctor, and he's telling this information to this person who was alive and with it, and you know, just here as a snowbird for 6 months, and is about to go under this major surgery where he has an 80% chance of not coming out of the surgery. Oh my God, my heart dropped for his wife, his children. I got so teary-eyed because I was just like in disbelief. And you know, it just showed me how things can change so quickly for someone. And that was definitely one of the most memorable times for me in the hospital during this rotation, was when that had to happen to my patient. And thankfully, when he went through all the procedures that he had to go through to remove the clot, and it was a very long procedure. I want to say it took us about 6 to 7 hours to get everything how it needed to be. And I did not assist, and it was 3 students on this case, and I did not assist in any of the procedures, but we did observe the whole entire thing. And an interventional radiologist was the person that basically did this procedure of getting the clot out of the vessel, and he made it. And I was able to see him the next day, talk to him the next day, and I was so thankful to see that he made it. So that was a really cool experience for me with that. But yeah, so he had an ischemic bowel, which it had died, and then basically it was dying. It hadn't completely died. He didn't have to get any of his bowel removed, and he was able to basically recover. He made basically a full recovery, and he was able to be discharged after about a week and a half of being in the hospital and being cared for. So that was such a good experience for me. I know other people have dealt with other things that were not as good in my group, but for me, that was a good experience. Another thing that we saw a lot of wounds. So there was so many wound debridements and, drainings and all of that. So we saw a lot of that. And actually, as students, we were able to go and change all the wound dressings, especially if we knew how to do it. They showed us, and then we just basically follow what they showed us. So, we would go there, change the dressing, irrigate the wounds and things of that nature, and try to make the patient as comfortable as possible. So we did a lot of that on a daily basis during this rotation. Our attendings, so one of our attendings was really into just operating on everyone. That is what he is known for. And that's what he did. And he was always in the OR. If you were trying to find him, that's what he would be. Another one of our attendings, he was really into wounds and wound care. And he has one of the largest wound care clinics in the state of Florida. So basically, he was the one that was really into, making sure that we understood wounds and knew how to treat them. And so he was a part of that wound care clinic. And we got to do that basically as a rotation. I only did it about twice because we had to rotate through all the groups. And you were able, if you wanted to, spend more time at the wound care clinic or more time with anything that you wanted to do in this rotation. They were very open to allowing you to doing more procedures than what was standard in our rotation. They were very open to allow you to go to the wound care clinic if that was something that you really were passionate about. You just had to make sure that whatever was assigned, that you completed your assignments, you completed your shift. And if there was nothing going on with your shift and your group was okay with you doing something different, then you were able to do that. They really didn't stick to, you have to do A, B, and C. They just wanted us to learn. And that's basically what I really, really enjoyed about the rotation. It was it was kind of laid back, I want to say, but it was a very, very much supported rotation by our attendings, and they really made us feel like we were doctors, and they really gave us that push of wanting to do more, and I really appreciate them for that. Our residents were the same. Our residents were great, fantastic. We had at least I had no bad experience with any of the residents. And I heard a lot of stories about other medical students that when they would go to rotations, they would get really bad attendings, bad residents and stuff like that. And I have to say that did not happen here on this rotation. Excuse me. And so I'm thankful for that, because it probably, it could have. The residents are very busy. They're residents, they're doctors, but they have a lot on their plate that they have to do. And so to deal with a student that is, some of us are trying to learn, but also some of us can be very overbearing, and some of us are know-it-alls. I mean, you have all these different personalities that you're dealing with. And so as a resident, I would feel that can be stressful, to try to navigate all those different personalities. But our residents, from my experience, they did a very good job with that. So I'm thankful for them for helping us through and allowing us to learn with them. We had to do weekly presentations, and the presentations were basically on topics that were given to us to do. And the presentations was for the whole entire group to do, so it wasn't just individual. And they were supposed to be about 15 minutes long, but that never really happened. They were always 20 to 30 minutes long, because everybody kind of wanted to make sure that they were covering basically everything about the topic, and it made the presentations a lot longer than what they were supposed to be. But we got through them, and it took a lot out of our day. If you work in the 6 a.m. to 12 shift, it was a piece of cake, because basically that's your whole day to presentation in that morning, which happened on a Wednesday. So your Wednesdays would be a good day, because you would basically do the presentations basically all morning, and then you would go to another meeting after that, which they called tumor board meeting, which we just met with different physicians, and they would present these case studies that came through the hospital, and they would talk about basically the person's diagnosis, their treatment, and the prognosis, and then what happened to that person. And they presented it to a board meeting called the TUMA board. And on that board, it was basically a radiologist, a pathologist, of course, internist. They even had heme-onc that was there. A surgeon was there. So, I mean, you had all facets of doctors that were there that were either involved in the meeting or just there to observe, because I think they were also given like educational credits for attending these types of meetings. So that's what we did on Wednesdays. Let's see what else. That's basically it for the surgery rotation. And my opinion of it was that I really enjoyed the rotation. The first week, of course, I didn't really enjoy as much, but after the first week and after I saw like what we were supposed to be doing, like I enjoyed it. I also enjoyed the OR to a certain extent. I didn't like being in the OR all the time, and I didn't. I chose not to go all the time. I would go to observe. I didn't want to be the student to scrub in all the time. I allowed other students that really were interested in things like that to do that, because I just felt like if it's not something that I'm trying to do, then I don't want to, I want to learn, but I don't want to take someone else's desire away if that's something that they really want to do. Like, why would I, sit there and scrub in and do things if that's, on so many cases, if that's not something that I want to do. So on the cases that were assigned to me based off of whatever patient I had, I would scrub in for those cases, but outside of that, I wouldn't scrub in for extra cases, but I would observe other cases. So for me, if you guys have been watching my videos, you know that I wanted to do OB, which is a surgery subspecialty. So you're in the OR, but you're not in the OR all the time. I like the idea of having a primary care aspect and also a surgery aspect. So I do like that idea. So that's basically where I stand for that. But, if you're in general surgery, you will be doing that stuff all the time. But I enjoy the rotation for the most part. I'm glad that I was able to get that experience. And I hate that we lost the last 2 weeks, so you can't get those back. But if we're able to do any of our internal medicine rotation, we will be at that same hospital. We will still see those same physicians along with other physicians. And they actually invited us to still participate if we wanted to participate in any surgery things. So that's how good the rotation is, and that's how nice these attendings are. So yeah, so that's basic my surgery rotation. If you have any questions, just please leave them down below. Also, don't forget to subscribe to my channel. And like and share this video if you found it helpful, and just leave a comment, but yeah, that's basically it. The video is 18 minutes long, and I apologize for that. Most of my videos, they're long, but I try not to make them long, but getting better at it. I'll talk to you guys later. Bye.